Hello, everybody. Good evening. It is Wednesday. I almost said TGIT because typically I do a lot of these question and answer sessions on Thursday, but my week is a little bit messed up because it is the end of the school year here in New York. And I'm not working tomorrow, but I'm working on Fridays. So normally I work Thursdays and I'm off on Fridays, but my son, my fifth grader, is having his moving up ceremony. So my schedule is a little bit off. So that was a long way of saying happy hump day, everybody. Happy Wednesday. I'm super excited. Hope that everyone is hopping on and we can start to talk about a subject really near and dear to me, which is lumps and bumps. And this month, the month of June, we're focusing on cats. So if you're here, I would love to see who's here. Why don't you jump in the comments and tell me who's here and where you're from. I'm trying a new online or new site with this because I've had some glitches with the other one that I was using. So hopefully everything is going to be smooth and work. And yeah, again, so if you're here, give me a comment. I would love to see who's here. So I see Kai. Hopefully I'm pronouncing your name correctly. Hello and welcome. Super excited to have you here. Hopefully Caitlin is on as well. Oh, from Taiwan. That's awesome. So I love that when we get an international group. I was in Taiwan speaking. I did a whirlwind tour of about 10 talks in 7 days. I want to say 2015, so a couple of years ago. So beautiful country, didn't get enough time to sightsee and definitely worked too hard. So Jeanette is here. We have someone from Texas. It says MVZ, so I might be mispronouncing your name. So again, everybody, welcome. I'm super excited to have you here. It looks like my new technology is working okay. You guys are always so nice with me. Last month we had to restart, but let's jump in. Everybody's time is precious, and I'm super excited about what we're going to be talking about. Hey, Rose, thanks for joining. So what are we doing this month? We're talking about cats. Hey, Lillian, how are you? Thanks for joining. I'm so glad you made it. All right, guys, what are we talking about? We're talking about cats, lumps, and bumps. We are going to do a little bit of an overview, and then hopefully if you guys have questions, now that I'm pretty comfortable that my new software we're being hosted by BeLive is working, that it's going to go smoothly. So I'm super excited. Before we jump in, the next question and answer, we have 2 dates. We're going to go back to Thursdays, which is my Friday. So either Thursday the 19th or the 26th. And Caitlin, you're going to have to remind me what topic we're doing. Are we doing dogs? We might be doing dogs, lumps, and bumps. So hopefully Caitlin can look at our schedule and remind me what I'm doing. But I'll be here and we'll be hopefully answering your guys' cancer questions. A couple of things I want to tell you. So started this in the beginning of the year, which with each themed month, I'm trying to give you sort of my pearls information, and they're coming out on Facebook. So every couple of days, sometimes multiple times a day, we're going to have these messages come out or these infographics, and at the end of the month, you'll be able to go to a photo album and get all of it. If you are a veterinarian or a technician or in school and you want to share these, please, hey, Eric, please share these infographics. Why am I doing this? I want to get the word out because cancer is a treatable disease, and especially with lumps and bumps in dogs and cats, early detection is so important. Welcome, Simone from Brazil. So again, look for the information. Again, we have 1 to 2 to 3 coming out each day with sort of the pearls about lumps in cats this month. Deanna is telling me that she emailed me over and over, so I'm sorry if I missed that, but hopefully we can take care of that after the broadcast. But if you have a question related to cats, lumps and bumps, we're definitely going to hopefully get to those, as many as we can today. So infographics on Facebook, feel free to share them, comment, tag a friend if you have someone that you think the information is going to be helpful, go ahead and share it. The other thing, as we talk about lumps and bumps, it is super important that a couple of things that we're going to talk about. We want to do monthly exams on our dogs and our cats. But I'm going to mention both of them because even though this is about cats, this information is pertinent to both dogs and cats. So we need to feel our cats once a month, put it on the calendar. Thanks, Kyle. She's saying she loves the infographic. That's Dr. Stevenson from up north in Watertown, New York. So feel free to share them. So we need to be very proactive with lumps and bumps in our pets. That means we should palpate them once a month. If you're giving heartworm preventative on a certain day, paying your rent on the first of the month, that would be a great day once a month. Put it on your eye calendar to feel your dog and your cat from nose to tail, feet, paws, everything for lumps and bumps. And then we want to find those lumps and bumps. We're definitely going to talk about the most common ones, Jeanette, but we want to find them and we want to document them. So we need to measure them. So you need a couple of tools for that. The first thing is called a skin map. And so you can get these, Caitlin's going to throw the link in the comments, but there's going to be a way to sign up to get these delivered to your email box. And so this is a little skin map. So you can put, is the lump, it can be hard for me to do this backwards, on the face, is it on the leg, is it on the side, up on the top of your cat, the bottom of your cat. So you want to be able to document where they are and you're going to measure them. This is exactly the ones that I use in my practice, and then we can keep track of lumps and bumps. And then you need to measure them. And so my guidelines, guys, are really simple. See something, do something. If the mass is the size of a pea, which is 1 centimeter and been there a month, I want you to go to your veterinarians and make sure you get an aspirate. We need to collect cells, look at them under the microscope, and know what it is. So what is a pea? So this is a centimeter. So I have a couple of different calipers that you guys can get to be able to measure your lumps and bumps. So these are plastic ones, really light, really easy to use. And I really recommend that every pet owner have these. And you can get these now on my website. And we're going to give you a link. And at the end, we are going to give you a code to get 15% off. You can use any measuring device, but these are really nice because you can put them around the mass and get it. And then you put it on the map. And then here, you can put the date that you saw it, the size, and then you can go in with your vet and not be like, oh, I can't find that lump on my cat's right, left side. Guys, for the first couple of years, I couldn't remember if Matilda's surgery was her right stifle or her right knee or her left. So it definitely gets confusing even for us veterinarians. So again, calipers and skin maps are definitely what you're going to need. And again, sign up for the link and you can get this delivered right to your inbox. And if you have a dog as well, we have one for dogs. So calipers, these cute little caliper pens as well. Kind of handy. They're actually functional pens, and they have calipers as well. So you can use that to measure the lumps and bumps. And then these are the ones that I use in practice. They're digital. They work great as well. They're a little bit heavier, but if you want digital calipers, those as well. So veterinarians and technicians seem to like these better. But again, I just want you measuring them and knowing what they are. So again, really important that we feel our cats once a month for lumps and bumps, document what they are, where they are, and what the size is. And again, if the mass is the size of a pea, which is a centimeter, which is the same size as an M&M or a Skittle, go to your veterinarian and make sure you get an aspirate. I can't look at a mass. You can't look at a mass. My colleagues can't look at a mass. Nobody can look at it and know what it is. So super important that we're proactive with lumps and bumps. Okay, so feel your cats for those lumps and bumps. The other really important thing to be successful with these lumps and bumps is that we know what it is before we remove it. Because if it's benign, your vet can do a much smaller surgery on your cat than if it's malignant. And the only way that we can make that first surgery, the only surgery, is to know what it is before we remove it. So again, really, really important that we know what it is with an aspirate. And in some cases, we'll do a biopsy. And again, we want to make that first surgery the only surgery. So again, my 3 rules: be proactive. Feel your cats for lumps and bumps at home. Document where they are with your calipers and your skin maps. Second one is know what it is before we have it removed. So make sure your veterinarian does an aspirate or a biopsy so we know if it's benign or malignant. And the third rule is make the first surgery the only surgery. And the only way we can do that is to know what it is before it is removed surgically. Don't just lop it off, then find out it's a injection site sarcoma, and then we're going to have to go back and do more surgery. It's going to end up being more surgery for your cat, more money, more anesthesia. So again, those are my 3 golden rules for cats. If there's any questions, throw them in the comments. I know there was a question. Let's see who asked. What are the most common lumps and bumps? So Jeanette asks us, what are the most common bumps in cats and where are they located? So really great question. Thank you, Jeanette, for that. And that was something that I definitely wanted to cover. So we're going to start with the most common cancer, or the tumor that we see in cats is actually benign. So that's great. It's called a basal cell tumor, BASAL. And the good news is they are about 15 to 20% of lumps and bumps in cats, and they're benign, so they're great, right? So again, with a nice smaller surgery than our malignant ones, we can cure cats of these cancers. But again, we need to aspirate them. We need to know what they are before surgery. So the good news is that the majority of tumors in cats are benign. How many are malignant? It is estimated, originally I had read earlier in my career about 20 to 40%, but there's a newer paper, a very large study of cats, that up to 50% of skin lumps and bumps can be malignant, right? So that, again, super important. And the other thing, people say, gosh, centimeter, a pea, an M&M is so small. Why so small? Just think about your cat's little legs, right? If we have a bump down on their legs, there's not going to be a lot of skin, a lot of tissue, a lot of muscle to be able to get those clean margins for the malignant cancer. So again, early detection is super, super important. Okay, number one, basal cell tumors tend to be benign. Smaller surgery is usually is what's needed for a cure, which is great. Then the next two are malignant. Then we go into the sarcoma family, which are soft tissue sarcomas, with fibrosarcomas being the most common ones. So those are connective tissue tumors, and those are malignant. And those are like soft tissue sarcomas in dogs, in that they tend to have root-like projections from the mass. So you may have a mass that may be like that big. That's a great question, Mickey. I'll come back to that. She's asking about what they feel like. So if you have a mass that's like this, there are going to be these root-like projections. Think of them like the roots of a weed. And if you just lop out the tree trunk or the heart of the plant and leave those roots, the weeds grow back. So what's really important with these sarcomas is we know they're malignant before we go to surgery, and then you can do a nice big surgery so you can get those clean and wide margins. We'll come back to these, but there's two types of sarcomas in cats, which is different than dogs. So there are the naturally occurring ones, and then there are these ones that have been linked to injections, with vaccines being the most common one. So we'll circle back to that. The third most common tumor that we see in cats is squamous cell carcinoma, which is another one, malignant one. We tend to see more, these are one of the few cancers that are actually due to the sunlight. So when I was in Ithaca, anybody, Kyle, Dr. Stevenson, I'm betting that you don't see a lot of squamous cell carcinoma in northern New York because they are sun-induced. When I was in California, I was in the Bay Area, we saw a lot more sun-induced squamous cell carcinoma. So in general, countries that are closer to the equator, where there's more sun and possibly less ozone, we're going to see more more squamous cell carcinomas than we see in places like Ithaca, where there's not so much snow, not so much sun, much more snow. So again, these are malignant tumors. We need to do big surgery, but again, these they can metastasize, but not quite as high as some of the other cancers. And then number four, so number one, what was it, guys? Basal cell tumors. Number two was fibrosarcomas and the soft tissue sarcomas, the malignant ones. And number three was squamous cell carcinomas. You're going to see more in places with sun. And number four are mast cell tumors, which are different than dogs. So mast cell tumors tend to be more malignant in dogs, but tend to have, most of them have a more benign behavior in cats. So again, surgery can be curative for those guys. So those are the top four cancers, skin tumors that we see in cats. So Mickey asked, are basal cell tumors soft, squishy, or firm? Guess what the answer is? Yes. So they tend to be a little bit on the softer side, but that's the whole thing with these tumors in dogs and cats, is that you can't feel them. It doesn't feel like cancer. It doesn't not feel like cancer. It can feel fatty. It can feel soft. It can feel firm. And that's just not going to be a great indicator of what it is. So that's why it's important to aspirate it before we go to surgery. And then even if you've aspirated it, you want to remove it. You want to submit it for full biopsy when you remove it, because we learned so much more information about the grade of the tumor, the margins of the tumor, and things like that. So unfortunately, you can't know without, finding out what it is with, again, aspirating it and then submitting it for biopsy. Where I think it was Mickey or someone else, another question that was asked was, where do they occur? So the basal cell tumors tend to occur in the head and neck area, but not always. I've seen them on the trunks of cats as well. So again, you can really see them anywhere, even though we try to make generalizations. For the sun-induced squames, we tend to see them not only in areas with more sun, but in cats with less pigment, so white kitties. My kitty Raz used to have half of his nose was white and half of it was black. And when we were in California, he used to always stare at the white one because the white side, wondering if he was going to get a sun-induced squame, because I'm a paranoid pet parent too. And the squamous cell carcinomas, we tend to see them on the head and neck area as well. And when I was in California, I used to have cats that would have it on their ears, on their eye areas, on their nose. So you can see it in multiple locations as well, again, because that's sun-induced. All right, any other questions as we go through that? So Mickey just said that their kitty had a biopsy on Monday. Yeah, so unfortunately, you just have to wait for that biopsy to come back, and that stinks, right? Because biopsies can take 3 to 5 days, business days. So it is definitely a stressful thing to wait for those biopsy results to come back. So Mickey, we're all hoping for benign results, and definitely you can post on Facebook when you get those results back. And if we have, any support and advice that we can provide, we definitely will. All right. So how are we doing, everybody? Is that answering some of your questions? Hey, Lynn, how are you? Thanks for joining so much. If anybody's still listening, let's put a comment. I know, Mickey, it's so hard. So she just commented that it is so hard. I've gone through cancer with my own cat. One of my kitties had IBD and then turned into lymphoma, which sucked because I had to give him his chemo and he didn't do very well. It was really advanced and resistant. And then my other kitty had kidney disease, and my husband is an internist. So I had to take care of Jeter and he had to take care of Raziel. So it's definitely hard. And Mickey, we're all sending good energy for good benign biopsy results. So Jeanette wants to know, are the treatments in cats different than dogs? So I'm guessing, Jeanette, are we specifically talking about skin tumors? So in general, the Carla, I'll come back to your question. Sorry, they all pop up and I get a little bit distracted. So Jeanette wants to know that cancer treatment's different in dogs and cats. So the main way that we're going to combat skin cancer, and that skin, I also mean subcutaneous, so under the skin layers as well, the primary thing is surgery. We want to be able to remove them surgically. And a really good thing to remember is that most skin cancers in dogs and cats can be cured with surgery alone if we find them when they're small. So, and size has definitely been shown to be prognostic for many of the malignant tumors as well. So again, it's really important that we're finding them when they're small. So surgery, again, if it's benign or one of the lower grade malignant ones, surgery may be all that your kitty needs and is not going to need anything. If it's in an area the tumor's gotten too big and when they do surgery, they can't get clean margins, they can't get all of those microscopic cells out, and we're worried about recurrence, this is similar to dog, and in people, we're going to recommend radiation after surgery to sterilize those microscopic cells before they grow back. So that's similar. And then, so we use surgery plus or minus radiation for where the tumor is growing, what we as oncologists call the local disease. So if it's growing on the leg, going to move it with surgery. If you don't get clean margins, you're going to clean up the area with radiation. And then chemo is typically reserved for cancers that have a high likelihood of metastasizing or spreading. So in that sense, treatments are very similar. The principles of treating cancer in dogs, cats, and people are very similar in that you are going to use surgery and or radiation for the primary place where the tumor is growing, and then chemo for cancers that have a high risk of spreading or something really concerning on the biopsy, like the cancer cells are invading the blood vessels or the lymphatics and are likely to metastasize. But the tumors are different. Again, we tend not to see those injection site sarcomas in dogs. There's a few reports about them, but again, it's definitely more of a cat thing. And the injection site ones have a greater spread rate than the naturally occurring ones. So those tend to automatically get chemotherapy after surgery and radiation. And those require really big margins, recommended up to 3 to 5 centimeters. So if your cat has a 3 centimeter mass, which is this right here, if it's a soft tissue sarcoma, one of those injection site sarcomas, we want to get 3 to 5 centimeters around the tumor. So let's be conservative and say you're going to get 3 on each side. So that means your cat's incision needs to be at least, 9 centimeters. And if we're going for 5 centimeters on both sides, we're going to have to add another 4 centimeters. So we're talking about, think about that's like half a cat on their side and things like that. On a leg, we're not going to get margin. So again, it's really important that we're finding these lumps and bumps when they're super small, around a centimeter or two. And again, really, really important. So, again, that's why we're so proactive with lumps and bumps. All right, so we got a couple of questions going on here. Let me see if we can answer them. I'm going to scroll down. So Carla said, we did a biopsy that was benign, but 3 weeks and no improvement, another deeper biopsy. Yeah, and that's a great point, Carla. So it sounds like our kitty had a biopsy that was benign and still not improving. So I'm not sure if it was completely removed, but sometimes benign masses should be removed, and sometimes a small biopsy is not going to agree with how it's behaving, and you may need to do additional biopsies or get a second opinion or have them, look at more of the tumor. But it's really important that you don't just look at the biopsy or the cytology results isolated. You have to look at what's going on with the cat. If the tumor is growing really rapidly and behaving very aggressively and your biopsy says benign, I'm going to doubt that, right? So it's really important that you just don't take a benign biopsy result and say, meh, we don't need to do anything about it. Because again, it may be that it was just not a representative sample. So Carla, it's good that you're getting deeper biopsies. Biopsy second opinion. What the heck do I mean by that? What I mean is that you have your vet call the lab and ask for a different pathologist to look at the same biopsy. Depending on the lab, the fee's usually nominal. I often will actually get the slides and then send them off to another lab, to my preferred pathologist that I have a really good trust with, and that I can call up or email if I'm questioning the results. So biopsy second opinions are something you should definitely write down and talk to your vet about. So especially for unusual tumors, I'm inclined to do biopsy second opinions on a regular basis. And the cool thing, guys, is you're not doing anything more to your cat. You're just getting that sample that's already at the lab under somebody else's microscope, so somebody else can give you their opinion. So hopefully that is helpful. Casey says, my cat has a growth on his black ear, which we thought was a tick. Now it's the size of the pea. I will get this aspirated due to your advice. Thank you. I love that, Casey. You want to be very proactive. However, is this something you see a lot? Is it usually any particular type? So it's a great question. So again, the guidelines with it being the size of a pea and there for a month, because sometimes you may have some benign process going on, like your cat runs into a stick in the yard if they're an indoor-outdoor cat, or is wrestling with the other cat. And so they can have a little bit of like reactive tissue or scar tissue that's going to go away. But again, if it's the size of a pea and not improving in a month, that's definitely where we're going to do an aspirate. And if that aspirate's non-diagnostic, you're going to do a biopsy. So unfortunately, black cats can get cancers as well, but they're less likely to get the sun-induced squamous cell carcinomas. But again, unfortunately, I can't tell you a particular type. You can just sort of run through the numbers. We talked about basal cell tumors being the most common, and then the sarcomas and the squames, and mast cell tumors. Cats can get melanomas of their skin, which are different than dogs. So again, this is another great example where dogs are not small cats. Cats are not small dogs. It's late. Where cats are different than dogs. Why is that? Because in dogs, melanomas tend to be benign. In cats, they're a little bit more like people in that they tend to have a more aggressive metastatic behavior. So they're more likely to spread and things like that. So they're usually not benign. So I'm not saying, Casey, that that's what your kitty has, but again, definitely be proactive. And it's the size of a pea. It's perfect. Like, let's find out what it is and get that thing off. But again, let's find out what it is before we get it off. So the first surgery is the only surgery. Barb, hi, how are you? Where in the body do you see tumors in most cats? Malignant. Yes. So the sun-induced squames tend to be in the head and face area. The soft tissue sarcomas, the naturally occurring, can be anywhere. So, all over the body. The injection site sarcomas tend to be associated with injections. So let's talk about this, guys, because this gets a little bit scary, and I think it's super important to talk about. So originally, when we first started to notice the link between injections and cats getting these sarcomas, these connective tissue cancers that have these root-like, weed-like projections, it was associated with vaccines. And originally it was noted with the rabies vaccine and the feline leukemia vaccines. But over the years, we have learned that it is not just those vaccines, that it is other injections as well. So steroids have been associated, antibiotics have been associated, and we think that some cats have an overzealous inflammatory reaction to injections that in some cases can transform and become malignant. I am not against your cat getting vaccines. Vaccines are super important. So what you need to do is talk to your veterinarian about what vaccines are really important for your cat and what their risk is. I live in the Metro New York area, north of New York City, and rabies, hey Jen, is in our area and is in our wildlife. And so it is really important that we protect our families and we protect our dogs and cats with rabies vaccines. If you lived in a New York City apartment, like I did for years, it's going to be a lower risk, right? My cats never left the apartment, but vaccines are important and they've done really good job. Feline leukemia is, and feline leukemia associated cancers like leukemia and lymphoma are much less common because of vaccines and these screenings. So I'm not against vaccines and I do not want people to walk away with that. But what's important is we used to give vaccines in between the shoulder blades in cats. So we used to see a lot of these tumors and then they got really big, they were hard to find, and they needed big surgeries and radiation and chemotherapy. So now we're recommending vaccinations on the legs. So as a pet owner, guys, what do you want to do? You want to know where your cat got an injection and you want to monitor it. And these tumors have been reported to occur anywhere from 3 months to 3 years, in one report up to 10 years after an injection. So we need to be vigilant and we need to know where we're getting injections in our kitties and talk about what injections that our cats may need. All right. So it's really, really important that we know that. And those, again, are going to be more going back to the question, where do we find these tumors? Those are usually associated. So now the recommendations are for the rabies in the right hind leg, feline leukemia, I believe, in the left back leg. And again, we're documenting everything. So again, know where your cat is getting that injection, discuss which vaccines are really required. And they should also be given subcutaneously. So just under the skin, your vet's going to lift the skin and go right under it and not intramuscularly. Why? It's going to be easier to find if it's in the subcutaneous tissues when you lift up your cat as opposed to deep in their muscle, where you're probably going to find it much later. And then the other thing is we're recommending not to give multiple vaccines in the same site, separating them out and documenting them. So that could be something you could keep track on a separate skin map. Where did my cat get what vaccines on what date? And then make sure when you're doing your monthly monitoring that you keep track of that. So that would be a really important thing. Okay, so I hope that was helpful in that part. I'm going to scroll through the questions, and then if there's any more about, great. So I'm going a little bit backwards. Mickey just asked, is fibrosarcoma considered naturally occurring? So that's a great question. So the sarcomas, which fibrosarcomas are one of the subtypes, can be, they kind of branch out. They can be naturally occurring or injection site associated. The naturally occurring tend to have, in general, but we look at the biopsy information, specifically the grade, tend not to need chemo. They just need surgery and sometimes radiation. But the injection site, which can be a fibrosarcoma, so fibrosarcoma can be naturally or injection site, can be both. So any of the soft tissue sarcomas can be injection site or naturally occurring. How do we figure it out? It's usually based on biopsy. We see more inflammatory cells on the biopsy, and location is also going to be important as well, and things like that. So those are the things that we're going to be looking at. Thank you, Lillian. She just said very helpful. So I appreciate that. I'm always, making sure that this is what you got, good information for you guys. All right, what else have we got going on? So Eric, hey, how are you? You mentioned injection site. I struggle with vaccination. I know it's off subject, and I struggle with vaccination or not. Maybe a titer test. I've heard cancer at the injection site. A lot of vets are saying, oh no, vaccinate. So if I'm reading your question correctly, you're struggling with vaccination. And I'll be honest, I struggle with it too. I think not every cat needs every vaccine. Again, when I was in New York City with my cats when they were young, when I adopted Jeter when I was in the year before I started my residency in New York City, I was in Ithaca working for the oncology department up at Cornell. And he had just gotten his vaccinations from the shelter before I adopted him. And he had one in between his shoulders. And I was always so freaked out that he was going to end up with an injection site sarcoma from his rabies, which was given not in the, even back then, that was not the recommended location. So, I didn't vaccinate him for rabies when I was in New York City in the apartment on the 24th floor that they never went outside. I just didn't. There's been some reports about maybe vaccinating them in the tail. That's another thing. Will they get the right, immune reaction? So I think it's a difficult question to answer, and I think it's one you need to have a good conversation with your veterinarian about. I still think vaccinations are really important. I don't have cats right now, but we have dogs. We're outside, and a couple of years ago, my husband, who's a vet internist, got bit by a cat, and the cat tested positive for rabies, and he had to go through treatment. So it's definitely, talk to your veterinarian and find out what the risk. Titers are a good way to see what their levels are, but depending on your state, it doesn't always sort of count. So you can refuse to vaccinate, but again, if your cat bites, especially, like at the animal hospital, there could be repercussions for that if they're not up to date on their vaccines. So definitely talk to your veterinarian about it, but it's reasonable. But the other thing that I'm glad that you brought this up, because it reminds me to tell you, what's the incidence of this? How common are these injection site sarcomas? They're pretty rare until it happens to your cat. So it's thought to be about 1 in 100,000 cats. So not very common. Some studies up to 1 in 10,000 cats. So there's some variation in the different studies how common it is, but it's not super common. But again, there are things that we can do. And again, be proactive with monitoring your cats for lumps and bumps. Know where they were vaccinated. Make sure your veterinarian knows to give it sub-Q and not intramuscular. Just as we are our own advocates with our own healthcare system, you want to be your advocate for your cat and your dog's healthcare as well. So hopefully that is helpful, Eric. But I do understand your struggles. But again, vaccines have been really important as well in decreasing a lot of bad infectious diseases in our pets, both dogs and cats. Jessica wants to know, what about treatment for malignant melanoma in cat? Incompletely excised. Hey, Jessica, how are you? So incompletely removed from the ear and the base of the ear, unable to perform surgery, and radiation is not an option. So two things. So definitely recurrence is going to be an issue, and radiation would be the better. If you can't do more surgery, which sort of at the base of a cat's ear, probably not enough tissue to remove. So radiation would be a good option. And the nice thing about radiation in melanomas is they tend to need less radiation. They don't need daily radiation like a lot of our other tumors that we're treating in that scenario. It's usually weekly for about 4 weeks. But if radiation was not available, what would we do? So I do recommend chemotherapy in these kitties. I like a drug called Carbo. You're welcome, Eric. The melanoma vaccine, which is an immunotherapy that you use, is labeled for dogs. I have used it off-label in some cats, but I usually start with chemotherapy. So those are in general going to be better to prevent spread or metastasis and not the local recurrence. So really surgery and radiation. Sometimes we'll try metronomic chemotherapy, low dose oral chemo after the conventional chemotherapy to see if that will delay recurrence. But I do worry about 2 things for that kitty, Jessica. I worry about recurrence coming back, and then I worry about metastasis. So the other thing at the time, when it was diagnosed, you would want to do some chest x-rays, 3 views to make sure it hasn't spread to the lungs, and also an abdominal ultrasound to make sure it hasn't spread to the abdominal organs. So Jessica, hopefully that is helpful. It's hard to make much more, specific recommendations, but again, I would definitely think about something systemic like chemo as well. All right, it's 9:30, guys. Barb says, thank you for emphasizing how important vaccines are and to research where vaccines are needed for the individual cat. Yeah, this is definitely not a one-size-fits-all things, and vaccines are scary, and the interwebs often say scary things about vaccines. But I can also tell you it was pretty scary when my husband got bit by a cat that was positive for rabies, because rabies is pretty fatal. So, and we were about to head out to town for a conference when we found out the night before that he was that the cat was positive. So again, it is really, really important, and I'm happy to provide that information. Jessica, I'm glad that that was helpful. So, and also Barb, thanks for your comment. How does chemo work with cats? Is it weekly, routine injection, like people, or pill form? So that's another question from Mickey. Hey, Mickey, I love all your questions. They're great. So how does chemo work? So chemo, the goal of chemo, dogs, cats, and people, is to kill rapidly dividing cancer cells. And so our cancer cells are dividing undividedly, uncontrollably. Take a sip of water. Look, please. If you guys have been to any of my things, you'll notice that I only have closed containers near my electronics, because I once built a cup of coffee on a keyboard, and that was about 15 years ago, and I'm like a little kid. I cannot be trusted with an open container near devices. Okay, so chemo, the goal is to kill rapidly dividing cancer cells. There are some normal cells in the dog, cat, and human body that are turning over pretty quickly, and that's why we see our side effects. So that's why people lose their hair, right? Because our hair is continuously growing. Cats are pretty resistant to that, and dogs. Some dog breeds, their hair coat will thin out. There are poodles and some terrier breeds that they can get patchy bald, but cats will only lose their whiskers, not guaranteed, but they don't lose that. Their fur is not continuously growing. The GI tract are constantly making cells very quickly every couple of days. So that's why dogs and cats can get some vomiting and diarrhea after treatment. Cats, of dogs, cats, and people, guys, listen up, because this was really surprising to me in my internship and residency, are the least likely species to have chemotherapy-related side effects when you compare dogs, cats, and people. So cats tolerate chemo the best, which shocked me, right? They're these little creatures. You're like, oh, they're so fragile. No, they handle chemo the best. And then the third category of side effects is our white blood cells, our infection-fighting cells. And that's why dogs, cats, and people, they get their white blood cell count checked during chemo, before chemo, and then after. So is it weekly routine injection like people, or pill form? In general, most of the chemotherapy is injectable. Which ones we use really depends on the cancer. So I mentioned a drug called carboplatin for malignant melanomas. That's an injection. In cats, it's given intravenously. So we place a catheter into the front or back leg over about 15 minutes. And that is given every 4 weeks in cats. In dogs, we give it every 3 weeks. They can handle it a little bit more frequently and at different dosages. For the sarcomas, the soft tissue sarcomas in cats, I often use carbo and another drug called doxorubicin, alternating every 3 to 4 weeks. Just for like full disclosure, there are some cancers like lymphoma, which is the most common cancer that we see in cats, where they get weekly chemo and then every other week chemo. So the protocol depends on what drugs they're getting and what cancers we are treating. Most of the time, it's injectable. There are some drugs that come in oral pill form. So lomustine is one that we use for some lymphomas and brain cancers and things like that, and that's going to be oral. There's Leukeran or chlorambucil, which is given for low-grade lymphomas, which is given every 2 to 3 to 4 days, depending on where they are in the protocol. But in general, when we think about chemotherapy, most of it's going to be injectable, IV, but there are some that are available in oral form. And again, the length of the protocol, how often they're coming in, really depends on the cancer that we're treating. And again, injection site sarcomas, I usually give 6 doses of intravenous chemo every 3 to 4 weeks, as an example. So 6 doses takes about 4.5 months to do. Lymphomas in kitty is treated usually for a minimum of 6 months. But again, remember, lots of these kitties with, lumps and bumps, they're going to be cured with surgery alone, even the malignant ones. So like squames, mast cell tumors, and things like that, they may not need chemo. Some of the internal mast cell tumors in cats will need chemo. Lomustine is one, that oral one that I mentioned, that I will use in that protocol. All right. So Mickey, hopefully that answered your question. Like it's really going to depend on the cancer and the cat and what we're treating and has it spread yet or things like that. Eric, I'm sorry that you lost 2 kitties to cancer. Yeah, so, this is a really good point. I don't want to forget about mammary cancer, which is, something that you're going to be feeling when you're feeling your kitties. So cats have 8 mammary glands, so they start sort of up here on their belly, and so 8 total, 4 on each side. And again, size has been shown to be really important for those. So make sure you include their belly, their breast area in their monthly exams because early detection is really important. And breast cancer, mammary cancer in cats is like women. Tends to have a very high metastatic rate, and size has been shown to be predictive for long-term outcome, and they usually need chemo. Dogs is different. Half of dogs with breast cancer are benign and half of the malignant ones are cured with surgery. So only about 25% of dogs with breast cancer need chemo, but in cats, 80 to 90% are malignant with a very high spread rate. So another really important difference between, these tumors in dogs and cats. Okay, so Amber says, my older veterinary colleague and practice owner requires his associates to give vaccines in cats on the body wall behind the last rib, because he said it can excise completely and it never goes deeper than 1 fascial plane. He thinks amputation is way more traumatic. I never heard this before and refuse to do it that way. Have you heard this theory? I've heard other similar things. I'm going to put Amber's question up there, so it's a little bit long. But again, so Amber's just saying their older associate is recommending, can you guys see me? I'm up here. That the that they're doing it on the body wall. I wouldn't recommend doing that. So I have to tell you, what amputation seems scary. Cats really, really handle, we call them tripods. They handle it really, really well. And I have seen, this was actually my residency project was on injection site sarcomas in cats. And back then, so I did my residency in the early 2000s. And we had a lot of cats that these intrascapular masses, these body walls, and, cats needed, it was like, we called it a catectomy. Like you just had to remove so much of the cat to try to put, and they still needed radiation. So that would not be my recommendation. And often it's 2 fascial planes deep. And again, 3 to 5 centimeters around the tumor. Amber, wouldn't be my recommendation to do it that way. Okay. Moving on, Amber, I hope that answered your question. Lillian from Florida wants to know, is prednisone beneficial to treating cats with lymphoma? It is. So great question, off topic, but I'll let it go, Lil, since we're friends. But it's a good question, and nobody else seems to have a question at the moment. So is that okay with everyone? Okay, quick sidebar. We're talking about lymphoma. I brought it up, right? My fault. Okay, so let's pop up your question, Lil. So yes, prednisone is beneficial to dogs and cats with lymphoma. In kitties, I actually recommend a form called prednisolone, which is the active form of pred. And it's estimated that about half of cats don't have the enzyme to convert pred to prednisolone, which is the active form. So to me, since I can't test for it and I don't know, I always recommend giving cats prednisolone. We know that cats with lymphoma, with high grade, the more rapidly progressing lymphoma, without treatment, it's about a month. And with steroids, about 2 to 3 months. So that can definitely improve survival. With chemo, the cats that go into a complete remission with lymphoma can get out to a year, but there are a subset of non-responders. So prednisone, the steroids, prednisolone are part of the multi-agent chemotherapy protocols, which are where we get the best survival times for cats with lymphoma. But if chemo was decided against, I would recommend steroids. Don't want to start steroids till you have your biopsy and everything confirmed and all of your testing, because it will start to treat the tumor and mess up if you haven't done your ultrasound and all that other stuff. You want to get your testing done before you start steroids. But another big difference, guys, between dogs and cats. In dogs, we do not want to start steroids before chemo. It has been shown to make their chemo less effective. Not true in dogs and cats. Not true in cats. So if I have a cat that's gone to surgery, has gastrointestinal lymphoma, it's all recovered from surgery, it's not going to see me for a week, and the vet says, can I start steroids? I'm going to say absolutely, and then we can start chemo next week. If that was a dog, we're going to wait that extra week till they see me because I don't want to start the steroids before I start chemotherapy. So, Lil, hopefully that answers your question. All right, back to lumps and bumps. All right, guys, a couple things before we wrap up. If anyone doesn't have any questions, because I want to give my boys a kiss goodnight. Any other questions? Was that helpful, guys? I hope so. Caitlin, did you tell us what we're talking about next month? Did we decide? I don't remember. Okay, guys. So don't forget to sign up to get your skin maps, dogs and cats. Caitlin threw up the link. Hopefully we can put that up one more time. If you need calipers, you can go to, we're going to put up a link as well, but that is also on my website, drsuecancervet.com, in the shop section, and you can buy calipers and the digital and the plastic. We'll also throw in some stickers that I just ordered, little Why Wait Aspirate stickers, because that is my motto, Why Wait Aspirate. And here it is, guys. We're going to give you a 15% off code, and the code is Dr. Sue 2018. So that is your code to get 15% off calipers, and we will ship them out to you with some stickers. And don't forget your skin maps. All right, guys. I hope this was helpful. I had fun. She did tell us. That's because Caitlin rocks. Thank you, Caitlin. Dr. Caitlin DeWild helps me behind the scenes because I am technically not so good at this stuff. But I didn't spill my water on my laptop, so that is always an accomplishment. All right, guys, if there are no other questions, I'm going to wrap it up. The code, yep, there it is. Thank you very much, Caitlin. You're the best. Everyone say thank you, Caitlin. Thank you, Caitlin. And we'll see you guys next month. I appreciate your time. I hope this was helpful. Just remember, do tracheas collapse? Dogs, maybe. Eric, not really sure about that question. Yes, dogs can have collapsing trachea. Certain breeds are more predisposed. They usually have a honking noise, and it's usually when they're more excited. And go see your primary care veterinarian and not an oncologist about it. You're welcome, Carla. Guys, thanks for coming so much. I really appreciate it. If you guys have requests, topics that you want covered, throw them in the comments. I'll take a look at them. We're always up for requests and things like that. And, yeah, July is skin masses in dogs, and then we're going to do chemo misconceptions in dogs and cats in the month of August after that. So thanks, guys. You're the best. You're awesome. I appreciate your time, and have a great night.